Good afternoon, world.
Hello.
Good to see you all, world. We're happy to be here at the Right Physical Therapy Show. I am Dr. Kate Anderson here with Dr. Alex White today, and we are very excited to talk about a very cool subject that I don't think a lot of people know about. I hear about this all the time, and whenever people hear like, "Oh, you guys do that?" they're always surprised. The subject today is on dizziness, like vertigo, right?
Yep.
The question is, what is vestibular rehab, and how can PT help with my dizziness, right? Because I think a lot of people struggle with this. But before we get started, what do we got going this weekend, Alex?
This weekend in Twin Falls, as we have the Rim to Rim race, which we have been given the opportunity to get to go help the runners out. So we'll be down there. If you are planning on running the Rim to Rim or cheering somebody on, come say hi to us. We will be down at the finish line.
Yes.
With some treatment tables and, of course, Cade's lovely face.
Yes.
And probably wearing a t-shirt too, so you can see his biceps. But we'll be down there. Would love to say hi, as well as take care of any ailments people may be having, race related or not. So
Yeah.
I'm very excited.
We should take pictures of us crossing the finish line so it looks like we ran it.
Maybe they'll give us participation medals.
Yeah, that would be great. We would love that. So anyways, yeah, if you're participating or going down to watch, please stop by and talk to us at the Rim to Rim. So, but let's get to the vestibular system. I'm actually, like I said, really excited to talk about this today. I actually know a very good friend of mine struggling with this right now, so I've actually been talking with her about this, and so it's been on my mind a lot lately, and I've been studying a lot lately, and I'm excited to kind of talk about it today. So the vestibular system, you know, a lot of people have heard of like the inner ear balance system, right? I think a lot of people know what that is, but they don't necessarily know what that means, right? So the vestibular system is organs within the inner ear, okay, that is associated with hearing as well. It works closely with hearing, but also works closely with vision and eye movements as well, because everything is so interconnected within the skull. But basically what it does is it gives us it helps us with balance, helps us to control balance, it helps us to control our spatial orientation or awareness, kind of where we are in space, right? So as we turn, where are we? Also helps a lot with eye movements and where we go. So for example, when I turn my head, my eyes automatically know, because there's a reflex that happens through that organ that basically allows me to sort of turn my eyes in a way to where I can still see things straight, right? Because when I turn, the world doesn't necessarily now become like this. Mm-hmm. I still see things pretty straight, right? So there's just this connection, and like I said, balance, eye movement, spatial orientation, where we are in space. And you know, the makeup of the anatomy of this, there are 3 semicircular canals in this organ, and it's filled with what's called perilymph and otoconia, okay? So that perilymph is just a fluid, otoconia, a lot of people have heard of this, are crystals, okay? So crystals, little almost like stones within the fluid that sits in those semicircular canals. And if you picture this, if I've got a semicircular canal like this, when I turn and it's full of fluid, that fluid will move. And there are nerve cells within the organ, that as the fluid moves, it moves those nerve cells. So basically it tells you where you are in space, for example, right? There are also what are called otoliths, and what they do is they actually help you with like your linear acceleration. So I'm moving forward, I'm moving backwards, right? I'm going fast, so I have whiplash, right? Like whatever it may be. It just helps you know where you are in space. And so it's incredibly important if you like staying on your feet, right? If you don't mind falling down on the ground, it's actually not that big of a deal. But if you like staying on your feet, it's incredibly important. But that's kind of the anatomy of how it works. But we want to talk about this today because if anyone's ever struggled with dizziness or vertigo, you know that it is not fun.
Yeah.
In fact, I've had a few elements in my day, but of all the ones I've ever had, this has probably been my least favorite. It just makes you sick. You feel like you can't go and do anything. It really, you do not feel well when you're struggling with this. So Alex, give us an idea of kind of what it looks like, the different types of dizziness, and how we can diagnose what's going on with you.
Absolutely. So dizziness, I would say, the traditional vertigo that we're talking about is kind of classified as, some people would classify it as the room is spinning, or it feels like my eyes are shaking, or, you know, positional, meaning it only happens if you do a certain motion. Other times, there's other types of dizziness, such as like orthostatic hypotension, which means when you stand up too fast, that heart basically isn't able to pump blood all the way up to your head as quickly as you're demanding of it. So you get a little lightheaded, or you get a little dizzy, you pause for a second, it goes away. There's also other types of dizziness that can be more central in terms of nerve issues, or even I would actually say one of the ones that gets very much confused is called cervicogenic dizziness, meaning the muscle tension in your neck can actually do something similar as Kate described, is tell your head where it's at in space, but this side is telling your head it's this way, this side's telling your head it's that way, and so you're spinning in response to that. It's almost nerve overload. And that's what a lot of this traditional vertigo or dizziness is it's usually your body's way of saying, I don't like this. So what can we do about it, I think, is something that we're going to dive into now, but the biggest thing is making sure that you identify what kind of dizziness it is, and we can do that through some testing.
Mm-hmm. Yeah, exactly. So a couple things to come to mind that we can do. So for example, if what can happen with the crystals that we talked about, the otoconia within the semicircular canals, at times they can actually get moved into different canals, like the canals that they're not supposed to be in, basically, right? And so a lot of times that may happen from like head trauma, right? So this is closely associated with concussions, right? Or it could come from a variety of other conditions. It could be genetic, but that's something that can happen. There's something called the Dix-Hallpike maneuver, right? Where, here, maybe I'll just kind of show here. I'll give them an idea. Obviously, we would lay people down, but you basically take someone's head, have them look kind of at my forehead because I want to see what their eyes are going to do, and we drop them back in the table until their head is actually down, hanging over the table, and we look at what that does. Now, a lot of times that'll bring on symptoms, okay? If symptoms come on with that, it's indicative of what's called BPPV, or benign paroxysmal positional vertigo. One of my favorite things to say. It makes me sound smart. Yeah. Did you understand that? Sometimes if you say it fast, it doesn't matter what you say. But that would be one indicator that perhaps it's actually a problem with those semicircular canals and the otoconia within it, right? Sometimes you can have just vestibular hypofunction that develops over time, right? So, it could be that you're not super active. It could be that, again, genetics. It could be that there's some condition that could cause this. But at times, that vestibular system can actually just become hypofunctional or weak. And in those cases, actually, a lot of times what you need to do is not that dissimilar from what you got to do when you have maybe a weak bicep, which I think everyone can understand, right? You got to use the bicep, right? Yeah. So when I want to strengthen my bicep, I know that I've got to put weight on it and I've got to beat it up a little bit, right? Like I'm actually putting a strain on it to where it actually, you get these little micro injuries, and then as the body comes in and builds on top of it, it adapts, it becomes stronger, it becomes bigger, and it's more effective in functional activity, right? Mm-hmm. And so similar things happen with the vestibular system, right? And so a lot of times the answer when you're struggling with this stuff is what we call habituation exercises, right? Or vestibulo-ocular, which is also a fun word to say, training, right? So it's kind of interesting because I just recently saw somebody for this. They came in, they've had issues for a couple years actually, but kind of on and off, right? And never really knew what to do. They've had medications, they've had all sorts of things, but finally made it in to see us, right? And in their particular case, they had, anytime their head was oriented to the left, basically activating the left side of the vestibular system, and then looked with their eyes to the right, it brought on the dizziness, right? And a lot of times it was like movement. They were describing like, oh, the frame is moving right now on the wall. Like it just feels like I'm falling a little bit. Like it wasn't necessarily bringing on this hard spinning vertigo motion, but things started to feel funny. They started to feel a little bit nauseous and lightheaded, right? So I knew that when they activated the left horizontal canal and then used the vestibulo-ocular reflex to look to the right, that was the hypofunctional portion of this whole complex, right? And so what do we give her? We have her do that at home, right? Again, if I have a weak bicep, you work the bicep, right? And what's interesting is we did that in the clinic, and she left about 50% improved just from that one day of doing this, right? Now, as we send her home, she's going to develop this quickly. One thing I love about it is that, again, when I go home and do biceps, I have to be really consistent and build it up slowly over time to really see a lot of gains on this, right? But with the vestibular system, it's actually crazy how quick you can see gains in it. And that's one of my favorite things about vestibular therapy is that people get better, and they get better quickly when they're diagnosed correctly, right? And I love that about vestibular rehab. And so, the habituation exercises, which basically if you break that down, it's almost like you're trying to make a habit of the ability to perform all actions, right? So to where it's just easy, you're basically improving its ability to be strong and be able to handle any movement you put on it. Those are one way that we could treat vestibular systems. What was another way that we could do that?
So just going on, building on that, is that this is a rapidly changing system, and unfortunately, too many people that are treated for vertigo kind of kick themselves after that first or second visit because they've been dealing with it for years and years, like Kate just described. Another positional thing that we can do is we can actually, based on Kate, that all was probably clear as mud, is this position does this canal. We handle that. We try and educate as we see fit, or as we need to for each patient. But different positions of the head are basically stress different canals, and so by doing that we can reposition and we can stimulate the right area. Or for instance, as some of that anatomy, sometimes some of that otoconia will actually break off and, like he said, go into a different part, or the receptors will just be receiving an inaccurate signal, and so you need to basically stimulate it in an appropriate stress to free that area up, or to basically get it so it's functioning properly. Sometimes that's an immediate relief. Sometimes it's the opposite, where somebody doesn't like you very much for that first time, but then the next time's better, and then the next time's better. Is that with this, it is rapidly changing, and there isn't a pop quiz at the end of our video. Unless you want one, we can probably talk on the phone. But biggest thing is that if this is something recurrent, dizziness is not normal. Even though it goes away and it's something like, oh yeah, every 6 months this comes back, or every time I go back to yard work in the spring, or every time I go to, blow out my sprinklers in the fall, I get dizzy for 3 or 4 days and then I'm good to go. Like, that's not normal. And unfortunately, we classify it as normal and then we deal with it again, versus here's what we can do about it. Let's get rid of it. Let's prevent it from coming back. And I think that's the main purpose of what we want to hit on today, is that dizziness isn't normal. We can work with dizziness. And I think if it's been happening for any amount of time, there's something you can do about it.
Yeah, for sure. And I think, one of my main takeaways, last takeaway I'll say here, is that the most common treatment for this, sort of the gold standard in the medical world right now, is to is to prescribe you medication, right? And I think the medication will help temporarily, but just like so many things, you won't be able to get to the root of what's going on and truly get the long-term fix. And so typically what I see is that you get on medication and it's just what you described. But 6 months later, it's like, oh, it's back, I better go get the medication again. Something is going on. There is hypofunction with that vestibular system that we can help with. And so definitely give us the opportunity to do that. Any last main takeaways for you?
I think just highlighting the post-concussion is the majority of the people that I see for some of these vestibular issues, is it usually goes undiagnosed because you're focused on, can I go back to school? Can I go back to work? Can I just not get a headache? And like, oh yeah, I get dizzy sometimes. It gets so swept under the rug, I think, traditionally, when really it's super treatable. And unfortunately, it also shows that the brain is not fully healed. That shock that goes through the brain when you have a concussion. Go back and watch that video. Definitely a passion of mine as well. But definitely just highlighting that is, if we can address dizziness fully and address the root of it, we're going to get it better.
Awesome. Well, definitely, we have 14 locations throughout Southern Idaho. If you are struggling with dizziness, with any lightheadedness, anything like that, please contact us. We can help you. We can at least point you in the right direction. So come see us, and we will help where we can. Thank you very much.
Thank you.